Mr. President, I want to commend the senator from Tennessee. I totally support his approach. I think handling health care reform in a way that reflects a more thoughtful, step-by-step approach is the correct way to proceed. And the leadership, the Democrat leadership in the House of Representatives, wanted to pass a health care reform bill, Mr. President, in the worst possible way. And they succeeded on Saturday passing it in the worst possible way. It is a 2,000-page bill which was debated for about 4 hours and passed on a party line vote. It was a partisan bill, a very limited amount of debate, very few number of amendments that were offered. The Republicans, I think, were able to offer one substitute during that entire debate, and they passed out a 2,000-page bill that expands the federal government by $3 trillion over 10 years when it's fully implemented. So you have a 2,000-page bill coming out of the House of Representatives, a $3 trillion expansion of the federal government, and I think what the American people are probably asking in observing this process, Mr. President, what does it all mean for me? Well, let me tell you what it means if you're a taxpayer in this country. If you are someone who currently doesn't have insurance in this country, you're going to pay higher taxes. If you're somebody who has insurance, you're going to pay higher taxes. If you're a medical device manufacturer, you're going to pay higher taxes. If you're a small business, you're going to pay higher taxes. If you are someone who has a flexible spending account, you're going to pay higher taxes. If you're someone who has a health savings account, you're going to pay higher taxes. If you're someone who itemizes on your tax return and deducts your medical expenses, you're going to pay higher taxes. So pretty much, Mr. President, that kind of covers the gamut. Everybody in this country is going to be hit with higher taxes to pay for this monstrosity, this 2,000-page bill, which, according to the CBO, raises taxes in the first 10 years by $750 billion. Now, what's interesting about that, when I mentioned that people who don't have insurance are going to pay higher taxes, there's what's in this bill what's called an individual mandate. And those who would pay the higher tax under the individual mandate, and it would cost about, or it would raise taxes by about $33 billion, are people who currently don't have health insurance coverage. Now, what's interesting about that is that the CBO has looked at who would be impacted by the individual mandate and found that almost half of that tax burden would fall on taxpayers that are making between $22,800 a year and $68,400 a year. So about half of the individual mandate, about half of that $33 billion tax increase would fall on individuals who in their incomes fall into the middle of that category, $22,800 a year to $68,400 a year. That's according to the Congressional Budget Office. Now, it raises taxes by $135 billion on businesses through what's called a pay-or-play mandate. In other words, if you don't offer health insurance, you don't offer insurance that meets the government requirement, then you pay payroll tax, starting at 2% up to 8% of payroll. That raises $135 billion in this bill in additional taxes and taxes that are going to hit small businesses. And there are also taxes on what they call high-income earners. That raises about $460 billion in the bill, and it's designed to hit people who make between $500,000 and up to $1 million a year, which is sort of the traditional, we'll, tax the rich and pay for this thing. The dirty little secret in all that, Mr. President, is that that tax hits a lot of small businesses. In fact, about a third of that tax is going to fall on small businesses who file or who are organized as subchapter S corporations or LLCs and therefore file on the individual tax return. And so you're going to be faced with a situation where a small business next year, when the tax cuts that were enacted in 2001 and 2003, the top marginal income tax rate goes from 35% up to 39.6%, you will add in this health care bill, this 2,000-page bill, a 5.4% surtax on those high-income earners. And so if you can believe this, the top marginal income tax rate, federal income tax rate in this country, will go up to 45%. 45%. That's the highest rate that we've seen in 25 years. And as I said, Mr. President, it'd be one thing if it were just hitting high-income individuals who are making more than $500,000 a year, but it doesn't. It hits small businesses that are organized as partnerships, subchapter S corporations, LLCs, and therefore file on an individual tax return. And so you've got $460 billion of tax increases there, $135 billion in the pay-or-play mandate, $33 billion in tax increases through the individual mandate, all totaled $752 billion in new taxes in this 2,000-page bill that are going to be passed on and paid by the American public. Now, the Joint Tax Committee said that in the Senate bill, now, by the way, this is the Senate version of the bill, Mr. President. This is only 1,500 pages. We don't know, as the senator from Tennessee pointed out, what the final Senate bill is going to look like. All we know is that this is the version that was reported out of the Senate Finance Committee. 1,500 pages, also filled with higher taxes on individuals and small businesses. And what's interesting about this is, again, the argument was made that we'll make the people who are, the wealthy, the affluent, pay for this. But what the Joint Tax Committee found was that 87% of the tax burden in the Senate Finance Committee bill would be paid by wage earners making less than $200,000 a year. And a little over 50% would be paid by those making around $100,000 or under $100,000 a year. Now, if you fit into those income categories, $100,000, $200,000, under that threshold, there are 46 million Americans who will be hit with higher taxes under the 1,500-page Senate Finance Committee bill as opposed to the 2,000-page House bill that passed the House of Representatives on Saturday. And so I say all that, Mr. President, just to remind my colleagues that when you talk about a massive $3 trillion expansion of the federal government, it has to be paid for somehow. And of course, in this case, as I said, it's paid for in the form of higher taxes, and it's also paid for by way of Medicare cuts that are going to hit very hard on seniors across this country. $170 billion in cuts to Medicare Advantage, cuts to providers like hospitals, home health agencies, hospices. Everybody gets to have their reimbursements cut in order to finance this $3 trillion monstrosity of an expansion of the federal government here in Washington, D.C. Now, having said that, it would be one thing if, in fact, the purpose or the goal was accomplished, which is to reduce health care costs for people in this country. Ironically, after a $3 trillion expansion of the federal government and three-quarters of a trillion dollars in additional taxes in the first 10 years, you don't see any impact on rates, on insurance premiums for this people in this country. In fact, they're not going to go down, they're actually going to go up. And I want to read for you what the Congressional Budget Office said about that, Mr. President. The CBO says, and I quote, "On balance, during the decade following the 10-year budget window, the bill would increase both federal outlays for health care and the federal budgetary commitment to health care relative to the amounts under current law." That's consistent with everything that we've seen and heard so far from the Congressional Budget Office about the impact that this bill would have on overall health care costs and on the premiums that average Americans would end up having to pay. Now, with respect to state governments, because something has been said and been made in this bill about the expansion of Medicaid, and in fact, there is a massive expansion as well of the Medicaid program to the point that a decade from now, 1/4 of the entire population of this country would be on Medicaid. And this was a program, of course, that at one time was designed to assist poor, disabled, people who really need help, need assistance with health care. A decade from now, with this expansion of Medicaid, you would see 1/4 of our population on Medicaid in this country. And the other component of that, the element in this bill that I think should be so disturbing to states around this country, is we all know Medicaid is a state-federal shared responsibility. And I see the senator from Nebraska, Senator Johans, who is a former governor of the state of Nebraska, knows full well about the cost of Medicaid to state budgets. Well, what this bill would do is it would increase the amount of cost that would be passed on to states by $34 billion. So states are going to have to look at how are we going to finance this thing, probably in the form of additional and higher taxes. And so, Mr. President, you have, again, a $3 trillion expansion of the federal government, cuts to Medicare that will affect not only seniors but also most providers around the country, massive increases in taxes which will hit squarely at small businesses and individuals, and particularly individuals, as I said earlier, who make less than $100,000 a year. Okay, well, I will yield back my time and yield to the senator from Nebraska, but would simply indicate, Madam President, that we need to do what the senator from Tennessee suggested, and that is start over and do this step by step, rather than this massive expansion of the government that will raise taxes and increase health care costs for people in this country. I yield the floor.